Chagas disease is a parasitic infection that is caused by Trypanosoma cruzi that is most commonly seen in Latin America, and these patients will usually present with the Roman's sign, which means that there is swelling around the eyes and will later on develop cardiomyopathy. Other complications include megaesophagus as well as megacolon. Now, Trypanosoma cruzi can exist in two different forms. One is the amastigote, which infect the tissues as well as cells and then increase in number by binary fission. And then later on, they will transform into trypomastigos, which will be released inside the blood. And in fact, one way to recognize the infection is to look with microscopy to the blood and check for the presence of the trypomastigotes, which are shown here. An alternative way of detecting the infection is to check for the IgG antibodies against Trypanosoma cruzi. Now, the vector that transmits the infection is called Reduviid bug, and the trypomastigos are present in the feces of the Reduviid bug, so not the saliva, in the feces. And once the bug makes a bite, the patient will start scratching and forces the feces, which contains the trypomastigos, inside the wound site and thus causes the infection. So again, the feces of the Reduviid bug contains the trypomastigos and will transmit the disease. Now, in case you have difficulty to memorize all the features of this infection, all you have to do is just to memorize this sentence. So this is a memory aid that will help you remember all the details for this infection. So here we have Romance cruise trip to Shanghai by a mega red fleet. And Romance goes for Romana's sign, which means that there is swelling around the eyes. Cruise trip goes for Trypanosoma cruzi infection. Shanghai goes for Chagas disease. Mega goes for cardiomegaly, megaesophagus, as well as megacolon. So megacolon and megaesophagus. Red goes for the Reduviid bug, so Reduviid bug. And then Freet goes for the treatment, which is by the nifurtimox for this patient. So nifurtimox is used for the treatment of the Trypanosoma cruzi infection. Now, since we are on the topic of Trypanosoma, I would like to also explain the Trypanosoma brucei infection. So Trypanosoma brucei is another parasitic infection that is causing African sleeping sickness. And the reason this name is given to it is that this parasite will interfere with the circadian rhythm, as a consequence of which these patients will be sleeping during the day. In addition, these patients will have periodic fevers. And the reason that they have periodic or recurrent fevers is that the parasite undergoes antigenic variation. So once the body starts fighting the infection, the fever will subside, but then eventually the parasite will undergo antigenic variation and it can launch another attack, as a consequence of which there would be a fever spike. Body will start fighting it, and then the fever will go down again. Again, the parasite will undergo antigenic variation, and then another fever, and so the cycle continues. And then one high yield point is that the tsetse fly is the vector for the transmission of the African American sickness. So tsetse flies is transmitting Trypanosoma brucei infection. And again, just like Trypanosoma cruzi, for diagnosis of the disease, you can look at the blood smear for the presence of the trypomastigotes. And that concludes our discussion.